Hey folks, this is Alex Moseni from ClinX Academy. Today is February 26th, 2026. Oh my gosh. I'm so excited to have Dr. Raihan Faroqui with me today. Longtime friend and one of the smartest people in, I would say, in the digital healthcare innovation space, and one of the people I look to help make me smarter when it comes to thinking about AI and kind of where everything is headed. So Raihan, welcome. Super excited to have you here.
Alex, thanks so much for having me. We've been planning to do this for a while, and here we are.
Yeah, I know folks are just logging in, so um, maybe while we wait for folks to get on, we'll give them maybe another minute or so. We're gonna we're gonna do a little poll or survey here. I'm gonna put it in the chat. Um, let's see, public chat. So if you're listening, click the link in the chat, and we're doing a quick survey to see. Yeah, hi Alex. Please introduce yourself in the chat. On this platform, we're not actually able to see you guys. I wish I could see all your pretty faces. So yeah, please go ahead. Daniel, fantastic. Good to have you, man. Please put a little hello there. And if you could do the quick little Slido poll that we just put in there, amazing. We have Adam Bonder, Rachel Quinn, so many familiar folks. John Yang. John, great to see you at Vive. I hope you're recovering from all the festivities. Natalie, Adam Silver. Oh my gosh, this is like the who's who of the next generation of chief medical officers. I love it. Um, oh, guess so. Look at this. I didn't realize there's actually a poll feature in this platform we're using. So while folks are doing the poll, let me share my screen here. Screen for the poll results. All right, so the question is, what is your AI maturity? Are you guys able to see this? Check off all that apply. So let me put the poll link again. Folks, please we want to know, click the link in the chat to do the poll. Let's get some more responses. We've gotten 2 so far. Mehran, good to see you, man. Okay, so while folks are doing the poll, Raihan, why don't you introduce yourself? Kind of who are you? What are you doing currently, and take it from here.
Sure. So I'm a internal medicine physician by training, serial healthcare entrepreneur, been part of the founding team, first 5 to 10 hires of several AI powered startups in the last decade. Also an advisor and consultant. I work with early stage startups, variety of VC funds on deal sourcing and diligence. And a lot of my life's work really has been around understanding how to take innovation, how to build new software products, how to build new pathways for patients, and really bring that into industry, which means go to market strategy, business development, partnerships with the belly of the beast, with health systems, with hospitals, with outpatient providers, with health plans, and really seeing friction initially, and then learning kind of all these insights on how to make things go. I very much have this weird and wild background, as I think many folks in health tech have, where a lot of us are the misfits, the odd ones out, the eternally curious ones. And I always was like very curious about healthcare macroeconomics, which was very dissimilar to a lot of my peers. Being in New York City, seeing the consolidation of hospitals, health systems, practices being acquired, seeing new laws and policies, seeing new tools being built, I thought, that's probably going to affect how I'm going to practice 5, 10, 15 years down the line. But I think that singular focus was very different than the majority of my med school residency classmates. And I think it's fairly true for a lot of folks in this room. And now when I kind of look back, 10 years ago, I'm like, wow, like think about really how much has changed. A lot of my training started in like the early 2010s. And even in that time, there was a lot of like kind of early action. So I get really excited, Alex, of what's going to happen in the next 5 years. And in my career, I've very much had this like DIY education, if you will. I know we've talked about this a lot,
Yeah.
where, clinicians are trained to be really good doctors. Obviously, we can diagnose and we can treat, but we're not trained in P&L literacy, healthcare economics and how the money moves, venture capital, private equity, M&A mechanics. We're certainly not trained in legislation, policy, regulatory capture,
Yeah.
and good luck if you get any leadership, management, or corporate training,
Yeah.
right? How do you run a practice? How do you bill? How do you contract with health plans? None of this stuff. You have no clue.
Yeah.
You have to kind of figure it out. And I think the folks in this room were the ones who were hyper curious. And now that we see this daily deluge of regulatory change, business model change, AI and technology change, what do we do? Like, what's the framework? What's the coursework? And that's why I was so attracted to what you were building at clinics.
And I think that's why we wanted to have this conversation today. I feel like, and I think you feel this way. We're at a divergence point where change in all these different parameters is happening. It's happening so quickly right now, where you either decide now to jump in and learn all this stuff and evolve, or you're going to be left behind, right? So talk about this whole K-shaped economy. Why is that something? It's not limited to medicine. This is like happening in every industry now, right? So why do we keep hearing this phrase K-shaped economy, and we'll kind of talk us through that.
Yeah, Alex. So, for us, the framing of this webinar was the 10x physician. I think a lot of folks right now feel that they're the 1x physician because they don't have a grasp of what's happening in the macro and what's happening in the general healthcare landscape, right? And I basically see like 4 or 5 key levers of what's forcing this K-shaped economy, right? So the first one is that there's provider and payer P&L compression. Margins are tightening across most, not all, but most hospitals and practices. There's that top sliver, that top 5, 10, 15% that's doing incredibly well. Then there's everybody else who's, low margin or even negative margin. Obviously, rising labor costs post-COVID, reimbursement pressure, and all these new policies and regulations, value-based care risk transfer, and then obviously technology and AI adoption. What we've seen in other industries, what we're all reading headlines, is that C-suite is saying, I want you to do more with less. I want you to be more productive. I want you to be more efficient. Oh, by the way, we're going to have reductions in force. We're going to have layoffs because we now have tools. And there's a certain persona in healthcare and health tech who think that that's not going to affect me and my organization.
Yeah.
Right? That, oh, yeah, this is happening at Amazon or Bank of America or Delta, but it's not going to happen at my hospital, my health plan, or my startup, that we're somehow special. And I think historically that was true, right? But I think today, as we see very transparent statements from hospital, health plan, and even pharma leaders, that's very different. So I think that's kind of the framework that I'm looking at, that this next era, these next few years will look very, very different. I touched on this briefly, but regulatory and policy upheaval, several new CMMI models, team, Access, Elevate, Lead and ACO, Wiser, ongoing Medicare reimbursement shifts, VBC expansion, transparency mandates, prior auth reforms, a whole host of AI governance policies. These are going to materially reshape revenue models, business structures, and compliance requirements. Every administration brings its own set of opportunities when it comes to regulations and policies. And I don't think enough clinicians in this room realize how transformational legislative change is to the
Yeah.
business of healthcare and also to what gets adopted and doesn't get adopted. Right. And
Yeah.
I've seen that over and over in my career. Whenever C suite or executives have some type of regulatory policy that says you have to do this or you're going to get fined, or by the way, if you do this, you'll get paid more. Guess what? Those things happen.
Yeah.
Right. Everything else is kind of a nice to have. I'm sure you've seen that, Alex, in your career.
Yeah, I mean, I tell all my folks that, I mean, there's so much opportunity that's hidden inside of new regulatory structures, right? I mean, that's why I'm so excited about Access, despite the low reimbursement. But the Access program is allowing for reimbursement for essentially no human in the loop AI and automation based models in a way that never existed before, right? Now, CMS is not saying that explicitly, that this is us paying for AI and automation. They're not saying that explicitly, but that's essentially, if you read between the lines, that's essentially what they're doing.
Yeah. The low reimbursement is not the bug, it's the feature.
That's right.
That's the
right.
point.
Yeah.
So when I saw this outcry on LinkedIn, it's like you're missing the picture.
Yeah.
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 Abe Sutton and Jacob Schiff are being very transparent of what they're doing. So again, it's people have to get on board. Like the reality of yesterday, a lot of that, Alex, I think is really, shifting very quickly underneath our feet.
Yeah.
And then I think the big two that I'll focus a lot today on are the things that we can't stop hearing about, right? JP Morgan, Vive just finished. I'm going to be at HIMSS. I don't drink, but if you had a drinking game, every time you heard AI or agentic AI on a panel, you'd be drunk by 10 a.m.
Yeah.
Three, four things. Now, obviously, there's a lot of hype. There's a lot of skepticism. Things break. At the same time, inherently, we have to get really curious as an industry on this transformational tool, right? And it's going to be administrative, it's going to be clinical, it's going to be both, right? We've already seen the adoption of AI scribes. We're seeing what's happening right now with coding, billing, and revenue cycle management. I work at a company where we're doing, front desk call center automation. We can replace inbound, outbound phone calls. This is just the beginning, right? These are the earliest chapters.
Yeah.
And I think the majority of clinicians initially came from a space of honestly arrogance. Like, this is not going to affect us. Healthcare is different, right? And then there's a second category who I think is a bit more curious, but still like, oh, it's going to be administrative things. Like, it won't be clinical things. Oh, I'm a doc. AI can't automate me. And I still hear that phrase, Alex. And again, I just think it comes from a place of insecurity instead of curiosity. That's where I've always, it's like, if I actually just sat down and thought about, if you're a practicing doc, busy outpatient practice at a hospital, just think about all the stuff that you hate doing. I'm not saying AI should do those things, but I'm just like, get intellectually curious with yourself instead of this like reflexive, I'm seeing all this marketing, I'm seeing all this slop, like I just want it to stop. A, it's not going to stop. B, I think it's just get curious with yourself. Like, what could I take off my table and plate? And also, how can I start vibe coding? How can I start building some of these solutions for myself? Because guess what? In 2026, you don't need an engineer. You don't need to be technical.
Yeah.
I am not technical at all, but I've worked with engineers, data scientists, developers, and I've just gotten really curious about the language and the tools. And I just started doing it myself, and it's kind of cool and it's kind of
Yeah.
addicting. And again, I think it's that curiosity. It's like having that curiosity mindset, Alex, and having that 0 to 1 mindset, which I have, being at an early stage startup where every day is just about running experiments and, just doing a bunch of things. I think that's got me really immersed in all of these various tools and platforms that are out there. But it's really being able to reimagine what a better tomorrow can look like.
Yeah.
I know both of us speak with folks on the front lines all the time who are burned out, who want to leave practice, who are sick and tired of politics and bureaucracy. I mean, we're trying to keep it real here. And they feel helpless,
Yeah.
right?
So let's get to the meat of the matter. I think the folks listening buy in to the message, right? So a lot of physicians need help. They need advice. Where do I start? How do I know I'm, um, so take us to the kind of the next stage of this, Raihan. So if you're a frontline physician, you're dabbling a little bit with AI here and there, you're very curious, you are curious, and you want to start becoming like Raihan, where does one start? How does one educate oneself? Where should they focus their curiosity?
Yeah. So you got to build the infrastructure, the environment, and resources to make continuous learning a habit. I very much believe that your daily information diet determines your career trajectory. And I think it's one of the biggest takeaways uh, from this section, where I've had to DIY my own, ongoing wiki, if you will. So that
Yeah.
includes newsletters, podcasts, communities, conferences, so on and so forth. I'm going to share a link in the chat as I speak.
Yeah, and while you're doing that, I just shared a link as well. So we put together a little one pager from Clinex Academy on this same topic: communities, resources, tools, people. And I know Raihan has a phenomenal one as well that he just shared. If you are not able to access the chat, we will send these links in a follow-up email to everybody who registered as well.
And I think why this is important is, number one, as you think about your day to day, Alex, I want to make this very real. Everybody's busy, but you have these times where it's the 20-minute drive to work. You're at your lunch or dinner break. You're scrolling passively on your phone. Those are my continuous learning times, right?
Yeah.
I open up LinkedIn, I put on a podcast. This is where I'm learning. It's not like I magically have this time like
Right.
most folks here. So it's trying to find those snippets in your daily, weekly schedule, weekends, but you're actually putting that time aside to do this. I think most folks still struggle because it's like, well, maybe I'll just go to that one conference, maybe I'll
Yeah.
just attend that one event, and then I'm good. It doesn't work like that.
Yeah.
I think you and I had to DIY this for many, many years.
Yeah.
I hopped on numerous one-to-one calls. I just read so much. I listened to so much. And I kind of wish I had this playbook and this framework. And I think both of us are trying to provide these playbooks and frameworks now in like a very distilled, concrete way.
Yeah.
And I'm happy to give some like individual recommendations that I love. So for me, especially with Substack newsletters, I have a top 3 that I swear by. Blake Madden has Hospitology, which is a fantastic one for hospital P&L, finance, strategy, and M&A. If you ever want to understand how hospital C-suite thinks and prioritizes, that's a newsletter to read.
Yeah.
Nikhil Krishnan's Out of Pocket is a really great one for people who are looking to learn about healthcare innovation, about folks who are looking to learn about even just very basic concepts in other areas of healthcare that they're not aware of in like a very funny, easy to understand way. Chrissy Farr's Out of Pocket is a really great one that has a very, Chrissy Farr's Second Opinion has a very kind of wide lens that looks into industry, that looks into startups and venture capital, given her background. Elion has a really great vendor marketplace, Alex, that I love. I know a lot of folks here are always seeing vendors and potentially talking to vendors. Elion is a great place that kind of categorizes those vendors into different categories, provides reviews. So those are really good ones for me. Alex, I'm curious if you've got a couple that you always read.
Well, I love Out of Pocket, and I and I not only because the content is excellent, but also because he injects humor, and I think we all just need to laugh more in healthcare. So
Yeah,
I like that it's not pretentious and it's fun.
yeah, yeah.
Um,
That's cool.
I also like a related one, the Health Tech newsletter. Sorry, Health Tech Nerds newsletter, because it's based on active conversations that are actually happening from people in industry. I like that as well. There's also one. I don't know if it's Gist or Gist. I don't know the right way to. Uh, I guess it's Gist probably. Um, that's a pretty good one from like a policy perspective that I like. It's just once a week from some smart folks.
That's awesome. There's three podcasts I want to recommend. I like Vital Signs, which is by Jacob Efron at Redpoint VC and Nikhil Krishnan at Out of Pocket. Uh, Both Nejim and Jamma have AI podcasts, which I really love. It's Nejim AI Grand Rounds and Jamma AI. There's a Heart of Healthcare podcast by Hallie Tecco, who's a famed
Mhm.
angel investor. Pear VC has a really good healthcare playbook podcast that I like. And I think the idea is to just have a digest of ones. Some are clinical, some are business, some are startups. So it's like, find your two or three that you really like in each
Yeah.
category and just put them on autopilot as times go by. I'm a big Slack community guy. Health Tech Nerds, Scrub Collaborative, XPC by my friend Paul Yasmu, uh, probably are my top three. And I've just met a lot of people in the industry. I've learned from all the news that's being broken, how folks are analyzing it. I've used these Slack channels to sell, to market, to hire people, to get consulting and advisory jobs, just a variety of benefits by being active on these communities. My friend Sarah Gabauer runs a Slack called Machine Learning for MDs, MLs for MDs. So those folks who are coding or who have a background in computer science or who are non-technical or who want to get more technical, that's a really great one. Again, I know we both have shared links. So like go through these resources, kind of look at a couple of communities, newsletters, and podcasts that you like, and just start subscribing, start digging in.
I want to add on to what you just shared here in terms of like the value stream of these communities. It's everything you said plus one more that I think is really important, which is these communities are an open door opportunity for you to provide value. Okay. A lot of doctors ask me, like, how do I get started in this space? Right. Well, you have value. You're a frontline clinician. You're working in some sort of organization, right? You have experience. You have some sort of network or connections of some sort, right? If you go into these communities, if you go into Health Tech Nerds, there's always people saying like, "Hey, we want to talk to 10 doctors who are doing XYZ. We're trying to get feedback. Does this product make sense? Blah, blah." Like you can just go there and start saying, "Hey, I'll talk to you for 30 minutes." And you know what? You do 10 of those, you do 20 of those. Some of them will lead nowhere. Some of them will be interesting and you'll learn something. And a couple of them actually end up leading to some sort of opportunity for you where they say, "Oh my gosh, like your feedback was so great. Are you interested?" Like so many of my like initial roles were just by that sort of like go out there. And instead of asking yourself like, how can I make money by talking to this person? Say, what value can I provide? The other like great, if you start doing that, the relationships that you start to build there will almost always just lead to good things.
Yep. I want to double click on that, Alex. Being in the right spaces, talking with the right people, but being very proactive about your value is super critical. I speak with people all the time who are like, how do I become an advisor? How do I become a chief medical officer? How do I become a medical director? I'm like, first of all, what do you have to offer?
Yeah.
Right? Like, what do you have to give? Right? It's way more of like, I want versus, hey, I can give X, Y, and Z.
Yeah.
Right?
Yeah. I love that. I love
And
that.
so I challenge people to think like, cool, you're a doc. And
Yeah,
like, so what? So what? Does that mean that you want to help build a clinical workflow? Does
yeah,
that mean you want to help people hire, you want to help companies hire docs? Does that mean you want to help, you know, leverage your network of providers and hospitals and health systems and outpatient clinics to help with sales? Like, what can you
yeah,
offer? Right?
yeah,
It's not just I'm going to be a doc and I'll be here. If you need me, you can ping me. It's not how it
yeah,
works.
yeah,
I think people kind of lack this framework of what that utility looks like in real world
yeah,
practice, especially when it's in an alternative setting, like a startup company, or just like a company that's outside of the traditional hospital or outpatient practice.
yeah. Okay, what about conferences?
Yes. So this is a big one. Given that a lot of my current work is in I want to highlight a lot of the AI specific conferences that are happening. Stanford has an AI Health Week in the summer that I recommend to a lot of folks here. Harvard has a symposium on AI for learning health systems, or SAIL, which I believe has passed. Cornell has the Health Next AI Summit, which is coming up next week, and I'm intimately involved with that conference. I'm an alum and a kind of proud supporter of that gathering. Mayo Clinic has the Mayo Clinic AI Summit. But you can see the pattern here if you're looking at my screen. Like every academic health system, especially the top ones, will now have a very specific AI/ML conference. So if you're an alum or if you're part of these systems, again, get curious. Find the
Yeah,
people internally who might be leading this and go attend. Go meet researchers, startups, academics, and importantly, C-suite, right?
yeah,
Every health system and hospital now, they're spinning out these chief AI officers. They have these innovation teams. They're having, governance committees. Get active. Find the informatics person internally who, unfortunately, is, having to do all this stuff if it's a small place with less resources. So I hope this is helpful. Then there's the obvious kind of more innovation centric conferences. The big three are JP Morgan in January and SF, Health in Vegas in October, Vive, which is typically end of February, moves cities. And there's what I call the small but mighty Rock Health Summit in SF, Hit Lab is here in New York, Behavioral Health Tech Conference, been called the Super Bowl of behavioral health, Next Med, so on and so forth. So again, I wish somebody had given me this like 5 years ago.
yeah,
These are all the conferences, Again, choose a couple, reach out to people beforehand, offer to organize a breakfast or a lunch or a dinner. I do this all the time. I'll pop in and be like, hey, I'm gathering some people similar to me. We're doing a little breakfast, we're doing a little dinner. We might have like a little, fireside chat. Be an organizer, if you
yeah,
will. It's not hard, but you need to put in a little bit of work. I think for most folks, they're just like, all right, I'm going to show up. Like, now what do I do? Instead of being very proactive, being like, hey, do I have any contacts who are attending? Can I reach out? Can I broadcast on LinkedIn or Slack that I am? And oh, by the way, this is what I have to offer. This is what I'm looking for.
yeah,
I think that's the other thing, Alex, that's super critical is that folks need to be broadcasting. This is what I have to give,
yeah,
right? And this is what I'm looking for. Like, make
yeah,
that ask to your colleagues. I ask my closest friends all the time. These are the things that I am an expert in. I am looking for speaking positions. If you ever see them, think of me. It's very transparent,
yeah,
right?
yeah.
They refer me, I refer them. I am looking for these types of companies to advise. If you see them, send them my way,
Yeah. I want to add
right?
a few conferences to add to the awesome list you shared there. If you're interested in the Medicare Advantage space, I think Rise is a great kind of series of conferences to go to. NACOS, if you're interested in the ACO space, and APG for like value-based care, like medical groups. And the reason I'm these three, which are all in like the risk space, I think are particularly interesting. Is I think there's a lot of opportunity for physician executives to take leadership roles in these sort of risk-bearing entities, whether it's health plans, ACOs, medical groups. Um, all when you take risk, it's all about providing care in a more efficient way, which generally means like using technology, tools, and services to do things better, which is what this is all about, right? All of this innovation, it ultimately comes down to that. So if that's what you like to do, then you want to operate in an ecosystem that rewards the efficiencies that you can build, right? And that's why as much criticism as MA and delegated medical groups get, the fundamental thesis that the incentives should be aligned between the payer, the provider, and the patient, I agree with. Of course, it could be done better, but the fundamental thesis, I think, is a right one. And I think it's a great environment for innovative physicians.
Awesome. Alex, in this next section, I'll move on to productivity tools and skills.
Yeah.
I think about the 10x physician stack in this manner. So there's 4 levers. First, it's the knowledge layer. Then there's the business intelligence layer, the communication layer, and the automation layer. And I'll jump into these 4. So the knowledge layer, for example, AI copilots for research, clinical summarization tools, rapid synthesis of new literature. If you think back, 2019, pre-pandemic, kind of the old way of looking up clinical evidence guideline, going into PubMed, like reading a paper, those days are gone.
Yeah.
Right? And I still think like 95% of people are in that world, where today the reality is that you can set up feeds using Claude, OpenAI, or Gemini and saying, hey, these are the types of papers that I'm looking for. These are the type of guideline updates that I want. Send me, excuse me, a summarized email every month with what's happening there. And that's in your inbox every month, right?
Yeah.
So this idea of I now have to go get stuff is now flipped to the stuff comes to me that I want. It's in my inbox. I'm getting a text. And during my lunch break, I'm reading that versus I'm going out and searching for things on Google.
Yeah. Yeah, so just to emphasize, all these platforms have this feature built in. I know it's in ChatGPT, it's called Pulse, and the other ones all have it. So like you should definitely be using that. There's no reason not to. Yeah.
That's right. But people just don't know that you can. And I think that's the value of, tools like this. Claude has Claude Code and Claude Cowork. There's tasks, there's skills. OpenAI in ChatGPT, again, has an app marketplace. There's also tasks that you can automate. And again, I think what's key is that as you think about your minimum time that you have in the day, in terms of the knowledge that you're looking to synthesize, and again, if you're like a busy provider, busy clinician, you're whether you're primary care or you're a specialist, the guidelines are ever evolving. Literature is ever evolving. Like it's almost impossible to keep on top of reading all the top journals in your space. I know folks they're getting the journals directly to their mailbox and they're reading, which is awesome. But having things summarized with takeaways, I think is such a hack. And a lot of physicians in my circle have these types of automated workflows where, again, it's every day, every week, every month, information is coming directly into my inbox. The second one is the business intelligence layer. And I think this one is super important. So for those folks who are in leadership, who have P&L ownership, who are in partnerships, sales or marketing, who are capital allocators, in VC or PE, as you now think about financial modeling, EBITDA understanding, Alex, value-based care math, ROI calculators, actuarial economics. You don't need people anymore, right? Just large language models, some pretty basic prompting. Claude is now available in the Microsoft suite. It's pretty right as you're
Yeah.
in Excel. It's actually migrating from Claude Web to Claude Excel. Uh, I mean, it's made me so much more efficient. And again, not being an expert in these, like I am not an actuary, right? But having access to tools that can help you analyze and build financial models like an actuary is a hack,
Yeah.
right? And
Yeah.
I don't think people understand that you can use these tools today to do things like that.
Yeah.
You can drop in, you can literally go, to, let's say like Aetna's website. You can look at public filings. You can drop those PDFs into Claude and be like, tell me what this means. How does this impact my career? What are opportunities? That's the prompt.
Yeah.
Um,
Yeah.
things like that, and I think people have not used these tools. It's still like, I think it's still very much like search based. Folks
Yeah.
are still like, but they're not actually using these tools to kind of up their game outside of their clinical space.
I think there's 2 points I want to mention here, which I think like are the meta points. One is the value of compounding in terms of your personal growth, right? And I think that's what you're talking about, Raihan, with this like having a system and the resources by which you learn on a continuous basis, right? Because the real value comes when you accumulate all of this knowledge, the network, the connections, the insights over a long period of time. It's not something you do episodically, right? So one meta message is the value of compounding. The second meta message for me is the value of leverage, right? And that's the whole point of this 10x framing, which is, and this is why we're calling this a K-shaped economy. The folks who learn how to deploy leverage in the work that they do, right? And to learn faster, to work and be more productive. Their trajectory right now is going to be like this, and everybody else is going to go downwards. That's the big message. So it is, I think, critically important to invest in those skills and the learning and all of that. So, in a lot of folks don't. They're not even sure where to start with some of these tools. So one thing I might suggest, which I just thought of like earlier, right before this, I'm going to put this additional resource here. In this link called onlinejobs.ph in the chat. And it's an interesting thing. So onlinejobs.ph is a website where you can hire Filipino talent, right? And it used to be that folks would go there to basically hire like a virtual assistant. But what you can actually do is these folks who are there, they have all sorts of skill sets. There's accountants, there's bookkeepers, there's coders, there's vibe coders, there's all sorts of amazing talent there. You can go there and for not a lot of money, you could hire a vibe coder from the Philippines to spend 2 hours with you and show you their setup and get you set up and like hold your hand basically to do this. You could have somebody who's an expert in Claude Cowork, like sit down with you and again, get you set up. Like there's no excuse basically. So what is that link, Raihan, that you just shared? Can you describe it for the people who are just listening?
Yeah, so as you were speaking,
Yeah.
I was thinking of this site that I come back to where you're kind of describing that, again, there are these marketplaces of services professionals.
Yeah.
You can do whatever you need. And I'm like, there's also a marketplace for AI tools like that. And it's called there's an AI for that.com.
Oh, amazing.
Cool. So it's a dump of a variety of personal work, creative tools. Yeah, you search for what you want, and there's a bunch of open source and paid tools right there.
So let me ask you a related question because there's so much stuff out there. What is your system by which you kind of like, what's your second brain system? How do you keep track of all these different things?
Yeah, I have a couple of platforms where I kind of centralize everything. I've got like my own personal Notion, which is really helpful.
Yeah.
For folks who haven't used Notion, it's basically like a day-to-day like work management tool, project management. Lots of startups historically kind of had their day to day kind of organization there. So I just built one for myself. It's like my own
Mhm.
personal wiki, if that
Yep.
makes sense. So that's really helpful.
I do the same. Yep.
Yeah. Um, and then I have a couple of AI tools that are pretty much always running, um, like AI note taker tools like Granola. I use this. I use this new tool which is really cool, which is called Lemon AI. Lemon AI is a voice dictation to action platform, which is pretty cool. So I could basically, on my screen right now, I've got like 30 tabs open. People have probably
Yep.
like 50 tabs open. I think a lot of our day to day is just like opening tabs, typing stuff, and doing it. Lemon
Yep.
AI, I can just be like, all right, open a Google Doc, give me a summary of this business model, and it'll just do it. Like it'll
Yeah.
open the doc, it'll type it out, and it'll just do it. It can open up your email, give you a reply, and it's just dictation, right?
Yeah.
Um, so I think things like that are little hacks for myself. Um, but, but yeah, so like find a good like personal wiki type tool like a Notion to kind of
Yeah.
organize your second brain, if you will. Like, this is my day to day. These are things that I'm learning. These are my tools. These are my tasks. These are my goals. Give yourself KPIs
Yeah.
is a big one. This month I want to, deliver X. This quarter I want to deliver Y. End of the year I want to have Z, whatever those are. I think
Yeah.
too much stuff is up here. Just write it down. Uh, get an accountability partner. That can
Yeah.
be as well. So
Yeah, I want to echo all that. I use Notion as well. There's other platforms that are potentially maybe easier or more powerful. Notion's gotten a little bit clunky over the years.
yeah,
There's Obsidian. There's a lot of folks switching to ClickUp now for more like for task management. So that's another one for folks to look at. I agree. Like Granola is what everybody in the tech space is using as a note taker because it doesn't show up in the meetings, basically. Um, Whisperflow is another great tool for using like voice to both to write and to do actions. Although I haven't tested the action portion of that.
yeah,
Um,
yeah.
yeah, a lot of
AI is like Whisperflow on steroids. It's like
yeah,
Whisperflow plus ChatGPT. Yeah,
yeah. What somebody in the email, it looks like Payal Gupta asked, email tools to organize and not miss opportunities. Um, so I personally use Superhuman as my email
hmm
platform.
yeah,
I've been using it for 7+ years. I cannot live without it, even though they're charging for me for $40 a month. They have a really powerful AI tool built into it. Like I know this is kind of embarrassing, but like I remembered I had talked to an Asian female about some topic like 2 years ago, and for the life of me, I could not remember the name. So how am I supposed to find that? So I literally put that query in the AI. I said, I talked to some Asian female about this topic 2 years ago. Find the email, and it found it for me. Um, the AI is really, really awesome there, and it has all sorts of great tools so that you don't you can basically operate through your emails at, I mean, the whole thing is like 10x the speed that you would normally do. So it's all about like keyboard shortcuts, etc. What's
I want to.
GenSpark AI? What
I
is
want to go
that?
back to the productivity frameworks. I know we talked about the knowledge
Yeah.
layer, the business intel layer. There's a communication layer, right? So tools for building decks, for building social media posts, for scheduling posts. All of these things I'm using AI tools for. Now, it doesn't mean that I'm not giving copy or content. I think there's a difference between, hey, like here's a block of text, here's a group of unorganized notes, go clean this up in this
Yeah.
way. Like, that's mostly what I do versus here's a 3-letter prompt, now build me the whole thing.
Yeah.
Right? Now, there's no problem with the latter, right? But, a lot of the content that I put out on social, Alex, especially on LinkedIn, that's all my content. Like I'm
Yeah.
not generating that through anything,
Yeah.
but it's oftentimes like disorganized, and I'm dropping that into Claude and ChatGPT and just asking it to clean it up, to give it this
Yeah.
lens, to give it this voice, so on and so forth. So, as you think about the day to day of, I'm presenting at Grand Rounds, I'm presenting at a conference, I have to build a slide deck, I'm in marketing or I'm in sales. There are so many AI tools that folks should be experimenting with and using. So the one that I dropped in the link is one that I use fairly often. It's called GenSpark AI. And again, there's a lot of this now has been kind of commoditized.
Yeah.
It's being offered now by OpenAI and by Claude, but I would use this to generate slides, documents, images, videos, like all types of things. I would say, hey, like people are drafting decks all the time. I would give it a sample deck and say, hey, in the style of this deck, now
Mhm.
build me this new deck that I need. Oh, by the way, here's this document of notes. Go build the slides.
Yeah.
2 minutes later, I've got my slide deck ready to go.
Yeah. It's a lot. It's overwhelming, but which actually brings us to this like really important article or this post that came out. What was the name of the firm? This 2-year look back of what could be the case, and it dropped all the markets.
Yeah.
So, like, tell folks what was this important article? What was the reaction of the markets to this? And then what is your take? And I'll share my take.
Yeah. So, this went viral a couple of days ago. So it's called the Global Intelligence Crisis. And as I'm talking, maybe you can put it in the chat, Alex.
Yeah.
It was by Citrini Research, Citrini. And it's a hypothetical 2028 scenario in which, what if the premise was like, what if we're actually being bearish on AI, right? What if we what's the most bullish scenario? Let's just say like takes over everything, does all the things, like what happens? What happens to rapid AI adoption? And the two big things were mass white collar layoffs and then a collapse in consumer spending. Because if folks are laid off, they don't have money, there's no income, you can't buy stuff, right?
Yeah.
And these are two analysts who dropped this report, and it literally caused stocks of Fortune 100 companies to drop by 5, 8, 10%. I've never seen anything like this. And this could be fear-based selling, but I think this really is a signal that AI could commoditize parts of lots of enterprise workflows. And in the last few months, if we zoom out, the macro, especially if you've been following what's happening with Claude, Anthropic's Claude, with Claude Code, with Cowork, and then with the OpenClaw phenomenon that you've seen, is that, again, there's this idea that this software, that agents are going to be eating up software, which means that all these publicly traded enterprise software companies don't deserve the valuations. And this has caused major sell-offs in cybersecurity, data analytics, core software. And again, this is just the beginning. And again, I think the thing for me, Alex, which is so important, is that for this room, is how does this impact healthcare? This impacts healthcare in a really big way, because we're already seeing the beginning of it with RCM compression, with call centers, with clinical, administrative, and documentation orchestration. Just this morning, NVIDIA's Jensen Huang said that demand for compute is exploding because corporate America is racing to deploy AI agents. And their clients are getting a positive ROI on tokens. Guess who's in corporate America? C-suite of hospitals, health systems, and health plans. They're looking at this and thinking, what's going to be our 2-3 year plan to deploy these tools internally? And will that result in displacement and disruption? You bet.
Yeah.
You bet.
Especially when margins in healthcare are so slim, and being compressed even further. I think this is like it's I don't pretend to be able to predict what's going to happen, right? The second, third order consequences of this are incredibly hard to figure out, but I am willing to bet that it's better for me as a physician to be at the bleeding edge of the kind of the skill set and knowing this stuff than not, right? I mean, we already saw what happened. Where is it in Utah where they're allowing the AI to basically that happened way faster than I expected.
Yeah,
right?
I think what you're referring to is the kind of autonomous renewal of maybe a few hundred generic medications.
Yeah.
Um, it's already happening, right?
Yeah.
This is not like a
Right.
theoretical, already
Yeah.
happening. Startups are getting creative. They're working with legislators on, creative underwriting and insuring policies. I want to get very provocative for a second, Alex.
Yeah.
So when we think about hospitals and health plans, when you think about the middle layer of admin folks, people who are making, I don't know, like 90 to 180K, let's say. A lot of that work today can be replaced by agents. And C
Yeah.
suite knows this. They
Yeah.
know it, right? And it's important for us to understand that this is coming. And I'll give you one example. So, again, clinical administration and documentation orchestration. So, hospitals today, they employ utilization management nurses, prior auth coordinators, care navigators, quality reporting staff. There are
Yeah.
so many people whose job it is just to here's the quality thing. Did we do it? Check off the box.
Yeah.
These are portal driven, rules based, repetitive, documentation heavy. Agents can do all of these things.
Yeah.
Like it's not a theoretical. They can do them today. They can read charts, they can interpret payer policies, they can submit documentation, they can draft discharge summaries, right? And again, I'm not advocating whether this should or should not happen. What I'm saying is that the tech exists. There's a pressure on C-suite to do this for shareholder value. So
Yeah.
what does that mean for labor and for clinical talent? Right.
Yeah.
And I think that's the reality that I'm trying to wrestle with is that we
Yeah.
need to be prepared. And I think, Alex, to your point, how can I be in the room? How can I help shape this? How can I future proof my career? So my tasks and my functions are not being automated.
So, I was just at Vive and just came back, last night? And a number of folks who are in the chat are Clinex members and were at Vive with me. And they were asking me, what do you do here, right? What do you do as you kind of go around the exhibit hall? And one of the things I told them is I go around and I'm visiting basically almost every booth that I can get to. And I'm trying to understand, one of the things I'm trying to do is understand the roadmap, right? Of course, I want to understand current state, but where do you see, what's your roadmap for 2 or 3 years down the line? Because I'm trying to, I think so much of this is trying to see a little bit further than everybody else. And if you can see where the puck is going a little bit further than others, then you can position yourself better.
Yep. No, I totally agree. And I think this year we're going to hear ad nauseum about the implementation and ROI for agentic AI workflows. That's going to be the number one, number two, number three thing. Where, like 2 years ago, it was scribing, right? That's what it's going to be this year.
Yeah.
But I think why it's way more transformational is it's not just a single, scribing is a single workflow in time, where agents are a, complete reimagining of tasks and labor. So I think so this is going to be like a 3 to 5 year project in healthcare, Alex. This is not a flash in the pan that goes away, right? And it has already started in front office and back office. It's already there, right? Already there. As I mentioned, pre-visit intake, scheduling, refills, insurance verifications, prior auth denials. It can already be done today with AI. Already, right? So what's going to happen next? So I think the biggest elephant in the room is what happens with clinical care. When you look at companies like Doctronic, Counsel, Lotus, even Amigo, when you're looking at what VC is saying in terms of the types of companies that they want to fund, it's fairly obvious to me that autonomous clinical AI is coming.
Yeah.
Whether you like it or hate it or terrified of it, it's coming. Right?
Well, think about this. CMS already created a framework for it called Access. That's essentially what it is without them saying it, right?
Yeah.
To think that if CMS is already creating a framework for it, it's happening. One of the concepts I want folks to think about is abstraction layers. Okay. So just like you were saying, Raihan, that the layer one is like AI solving a single thing, like scribing, right? Then you have agents. It's almost like an abstraction layer on top where now the agents are doing multiple different tasks, and handling all of that. And for me as an individual, the abstraction layer for me above me managing a bunch of agents, and this is why I just put that online jobs at PH website, is what I was literally doing this morning is hiring staff, humans. I'm hiring humans, each of whom is going to be running a bunch of agents for me, because ultimately you still need a human in the loop to kind of manage some of these agents. And so for me, like meta message, it's all about leverage. So the more people you have working for you and the better tools they have that gives them leverage, the more kind of superpowers you get. So we have like 2 or 3 minutes before we're done. Raihan, back to you.
Yeah. I dropped a link to an article that was published by a VC who I respect. His name is Sebastian Caleri. And he gives these 3 levels of healthcare AI, where level 0 is administrative. It's already happening today, right?
Mm-hmm.
Scribes and voice agents. Level 1, we already have pilots that are live today. AI coaches, AI advocates, AI navigators. A lot of we offer AI doctors. They're not doctors. They're actually in this level, right? But what we're building out right now is level 2 and level 3. I think level 3 is going to be next year. I think this year will be level 2. And that's what Doctronic was doing with Utah, is supervised autonomous, right? So AI that diagnoses, treats, triages, and or prescribes medications to patients. So that prescription part is already started. The renewal has started, right? Which is prescription, with a subset monitored by a supervising clinician. And again, guess what? This is access, right?
Yeah.
And level 3, which is fully autonomous, right? For example, fully autonomous AI emergency triage line.
Yeah.
Autonomous agents, clinical agents, right? There's no human in the loop. It's coming. Autonomously diagnoses, treats, triages, right? Do we have the regulatory framework for this? Hell no.
Yeah.
But it doesn't matter, because innovators are going to do this. The capital allocators are going to fund this. And people who don't have access want this, right?
Yeah.
Now, is there going to be a lot of potential ramifications and complications and harm? You bet. But this is where we're heading here. And I think it's important to kind of grasp that. I know we have like 2 minutes left. While we were talking, as an example, I actually vibe coded something for the group. I'm going to share my screen. So I just went into ChatGPT and I said, hey, give me 5 examples that a clinician could vibe code for administrative or clinical use cases. Right? That was my prompt. So I'll just share my screen just so folks see kind of how I did this. Okay. You can see this, Alex?
Yeah, it's coming. Yeah, there it is. Okay.
So the first thing was you could do a prior auth auto draft tool.
Yeah.
All I did, I just copy pasted, like nothing fancy. I am not an engineer.
That brings up such a simple little hack that most people don't know. Have AI write the prompt for you.
Yes.
Yeah.
That's right.
Yeah.
That's exactly right. And then all I did is I pasted that link into some vibe coding tools, and I can give some Replit, Lovable, Base 44 are some that I use fairly often. Okay.
I think those are great. While he's loading, I love those. I personally use anti-gravity as my main interface. All right, show us what you built.
Sure. So here we go. So I just want folks to see, all I did, I just copy pasted that prompt right here. into base 44. And here is my PA auto draft tool. I put in the patient's initials, the payer. Look at this.
Yeah.
ICD-10 code, CPT code, procedure description, therapies, boom, generates the
And
letter.
for folks who recoil at this and say, what about security and all of this? Listen, this is not, Raihan's not claiming this is production ready, right? But it's an exploratory process. This is part of the curiosity that Raihan talked about. And if you can build a functional demo version like this, it's so much easier to go to an actual developer then and say, I want you to actually create the production version of this, right? And you've now removed 90% of the friction because they can see exactly what your vision is.
Yeah, that's correct.
Yeah. Amazing. Well, I know we're pretty much out of time. I do want to give a plug to my company, ClinX Academy. I know we have a bunch of ClinX members here right now. Our entire mission is basically helping turn physicians into 10x physicians who can then succeed in executive roles. Raihan, thank you so much for sharing with us all of the incredible kind of wisdom, thoughts, insights that you have. Any final words from you? Oh, and we want to say, if you are interested in ClinX, please use Raihan's name as a special coupon code, RAIHAN, for a special deal. Back to you, Raihan.
Yeah. So Alex, while I'll close off. If you can put that link in the thread for folks.
Yeah.
I'm a huge supporter of ClinX Academy. The idea, it's a mini healthcare MBA. It's what I wish I had 7 years ago. It really compresses a lot of this trial and error learning into this structured, physician-friendly framework. Helps you transition from a clinician to an operator, executive positioning, advisory roles and equity. Helps folks move into medical director roles, chief medical officer tracks, startup advisory positions, VC-backed company leadership. I think it's awesome if you're early to mid-career, looking to transition, you're a burnt-out hospitalist, you're curious about startups. How do I find one? How do I work at one? It's just like an awesome course. Big kudos to Alex and the team for putting it together. And hope folks check it out. And if you're interested, definitely sign up.
Thank you. And one last thing, the current ClinX folks who are here, I think can attest that we bring them opportunities. We have companies coming to us every week saying, we're looking for a medical director. We're looking for a medical director who understands VBC or AI or whatever. And we're sharing those opportunities, whatever we can do to help each other out. So thank you again, Raihan. Amazing. Much appreciated.
Sure thing. Take care.
Okay. Okay, I don't really know how to turn this thing off, so I guess I'm going to close the browser window.